Good morning, YouTube family and friends. I hope you had a good week. My week was mostly uneventful. Just a bunch of running around again with my mom, taking her to do her things. So today is Saturday, December 13th. Yes, December 13th, 2025. And this is my week 90 results of being back on Mounjaro while dealing with a host of other medical issues, the fun issues. So I'll start it off with my weight. Last week I had weighed in at 219, and this week I weighed in at 217, so I lost 2 more pounds. Yay! It's helping that this medication that the psychiatrist has me on is taking away my appetite. So I'm not mad about that. So that puts me at a total weight loss since being back on Mounjaro at a 19-pound weight loss. And for the last 3 weeks, I've lost 8 pounds. So yeah, my lowest I've been since I was over 300 pounds. I got all the way down to 210. But then I started experiencing my first issues of myasthenia gravis before I was diagnosed with it. And since then, no, I had gone all the way back up to 236. So at least I'm back down now to 217. So I hope I can keep that going. All the blood work that the neurologists want to do, all of it has come back now, as well as the urologist that I saw this last week. That the urinalysis came back. I do have a trace of protein in my urine, which could be causing the bubbles or foamy bubbles, we won't call it, in my urine. So, but they checked everything else out, and the kidneys seem to be working fine. But I don't know how you can say that because there's a trace of protein. So there's a trace of protein means the kidneys aren't working totally 100% fine because it is letting out protein. So I don't know. That's what the urologist said. So I guess I'm not going to worry about it. And the neurologist said, I don't know if I told you what the neurologist said last week or not. Maybe it was this week. He came back because he had me retake a little scale of the answer questions on a scale, and he totaled it up. And mine was a 7, which was an increase. So I told him how even when chewing, I'm starting to get jaw soreness on both sides, even chewing soft stuff. So I told him my arms are starting to get sore, kind of right in this area whenever I'm brushing my teeth or washing my hair. When I'm showering, I'm using a lot of my arm muscles all over and constantly when I'm showering, shampooing my hair, and then when I get out, drying myself off, and both my arms get sore there. So that's the first sign of weakness happening. And then of course my legs seem to be always a little unsteady in the shower. And I've noticed if I stand in one place for a little while, like I had my show at the Orpheum Theater this week, Tuesday. I saw the Notebook production. That was good, but it was sad, but it was good. But before the show, before they opened the doors to the stage, to where you get seats, I was just standing there, and I was starting to sway a lot, and my knees felt like they wanted to buckle a lot just by me standing in one place. So I've noticed I can't stand in one place for too long. Otherwise, my leg muscles start to get a little weak, which is causing me to sway and causing my knees to want to buckle on me. So yeah, that's the progression of my generalized myasthenia gravis. As far as the liver is concerned, I don't know if I said this last week or not, but the blood work, my ALT, AST, bilirubin, that was all fine. there was there was an it was out of normal a little bit for the urobilirubin, something that goes along with bilirubin, urobilirubin or something like that. It was at a 2, and usually it should be at a 1 or less, if I recall. So that was a little high. So that could be the first signs of the liver cirrhosis progressing. But thank God the bilirubin count in my blood is fine. So as of now, we think the liver's okay. But just one of those things where you just gotta keep an eye on it. I got so much to keep an eye on. And I had my 1 week follow up with a psychiatrist since she started me on that new medication that was a substance or narcotic, whatever you want to call it. I don't even remember the name of it. But I told her at my appointment this, like, I'm starting to take too many medications among all of my diseases. And I'm worried that I'm overworking my liver because a lot of these go through the liver, just like the trazodone goes through my liver. Like anti or metamorphosis or something like that. The liver helps take the trazodone out of your blood, and so it can go through the kidneys and be urinated out. But what I've learned, because we're still trying to figure out why I'm so extremely tired all day, every day. And that's one of the things I was researching, because my main doctors don't seem to want to help me try to figure this stuff out, which is very frustrating to me. It's stressing me out. It's not good for my anxiety and depression. So, but anyway, what I found out is trazodone, the liver has a hard time getting that out of the system when it's cirrhosis. And so it might leave some behind, and over time, because you take the trazodone every day, and I was on 150 milligrams, which is considered high, but it's not as high you can go, but it's considered high. And so it might leave some behind, and so every day you take it, it leaves a little bit more and more behind, which can cause a buildup. And that could be why I'm tired every day. Sorry, I'm tired, extremely tired every day, all day. So she agreed, and I told her I didn't feel a change at all taking that one narcotic, whatever that was called. I threw the bottle away when I ran out, so I don't remember what it's called. But so she didn't renew that one, but she did start me on a different one that I take at night, and it's a lorazepam. That's also a substance or narcotic, whatever you want to call it. So, but that's a very small dose. It's just 1 milligram, and I take it at night because I supposedly it can cause you to be tired or a little loopy. So I don't know. She did go ahead and reduce my trazodone down to 75 milligrams instead of 150. So I've been on a lower dose now for a few days. So far, I'm not seeing any effect on it, but I feel you have to give it a week or so in order to maybe see a difference, especially if that's what's causing my extreme tiredness. And so hopefully being on a lower dose will allow my liver, for what it's taking out of my system, to stop building it up in my system, if that's what's happening. Now, there's no way to be sure if that's happening or not. So, but at least my psychiatrist is willing to try something. It's more than what my other doctors are willing to do. So, yeah, my liver doctor, my myasthenia gravis, my neurologist aren't saying anything for me, because I tell them both multiple times I'm extremely tired all day, every day. And even if the psychiatrist gave me the okay to go back to work, I couldn't at this point because how tired I am. So, and with my flare-ups of my myasthenia gravis expanding, there's no way I can go to work. So, but I see my primary doctor this coming Wednesday or Thursday. Yeah, no, it's Wednesday. I see my primary doctor on Wednesday, so I'll give her an update on what's all going on. And all my blood works has already taken that she would normally do, except for my A1C. So she'll probably check my A1C to make sure my diabetes level is okay. And then Thursday, then I'll see my therapist before I go on vacation. I leave the next Saturday night to go on my Christmas vacation. I won't be back till the following Friday, the day after Christmas. So yeah, I'm looking forward to that. So, and I talked with MetLife. They're the ones who handles the long-term disability for my employer, because I got a packet in the mail this week, and it was a thick packet. So I was like, oh great, just like like college, if you just get a thin envelope, that means it was just a rejection letter. But if you get a big packet, that means you were accepted, you were approved. So I was excited when I got that packet, that big letter, big envelope from MetLife. It's like, oh yes, they approved me, yay. I opened it up. They want more paperwork. So I was really starting to stress again, because they were wanting me to get all my medical records for ever since I last worked, when I had that surgery on June 9th, up to current. It's like, no, how hard of a pain that is. And they said it all has to be done by December 31st. And I got that on the 10th. And it's dated 12/1. So it's like, I have 3 weeks. And I'm going to be out a week for Christmas. I'm going to be out of town a week for Christmas. Like, how am I going to get all this done? I started panicking. I started stressing. My hands were shaking big time. It's like, oh my God, I was starting to spiral out again. I'm just thinking about it and talking about it. I was on the phone with her at MetLife. It's my claim specialist. And I'm sure she could tell by my voice. And she's like, I'm sorry that you have to talk about this. As I was telling her, no, just talking about it is making me have anxiety. Yeah. All right. Okay, I gotta calm down. I want to give you guys an update, but thankfully she said, no, some of the paperwork that came in, there was like stuff I've already filled out. So a lot of it I didn't have to do again, thank God. And for the medical, for all my medical history documents, scans, and all that, she said she's working on it. But she said sometimes you can get faster if the claimant, so me, request it. But since she's already requested it, I told her I probably won't get any faster than you would. So great. There's a couple of things I had to fill out again. And they also want a new physician statement. But I told her, like, the psychiatrist and that company has a policy. They will not fill out any long-term disability forms until they have seen and treated their patient on a regular basis for at least 6 months. And the 6 months ain't up until February 21st. So it's like, I can't get that. And I told her, like, when my initial claim was sent in to you guys, now I had to really beg my primary physician to fill it out, telling her that my psychiatrist won't fill it out. And she was really hesitant because she's not the one treating me for my mental health right now. So, but since she was the one who initially saw me and recommended me to make an appointment with immediate care folks to see a psychiatrist and a therapist. Now she couldn't refer me because they can't refer to psychiatrists and all that stuff for mental health, but they can recommend where I could call to see if I can get an appointment. But she said she filled out basically the sections she could fill out, and then for the rest of the sections, like treatment and all that stuff what's going on, she had put on there, these sections have to be referred to Dr. Dusad, my psychiatrist, to fill out when she's allowed to, and that's all she can do. So she said they're going to look more into it on what they can do, and she did send a request to the psychiatrist just for all of her notes and whatnot, what they think is going on. No, so she's not asking them if she thinks I can work or not. They're just asking her for all of her notes, all my therapist notes that she gets from my therapist. And then they'll submit that to kind of like the people at MetLife who are kind of like our physicians who actually review all this stuff to see if they agree that at this time, they agree that I can't work at this time. And she also asked me if I want to work again in the future. And I told her, yes, I do, if I'm able to. And I told her that I'm officially terminated at my job on January 15th of 2026. They can't go back past that. So I'm officially terminated then. I'll lose my insurance, everything, my paycheck. So she said, thank you for telling me that. Yeah, so we will see. God, I'm still shaky. So, but okay. I think that's all I got for you. I am going to take my Mounjaro shot, 7.5, here in a little bit. I'm not going to record it for you. So, all right, folks. I hope you have a great weekend. I'll be cheering for my Bears again. They took a tough loss against Green Bay, but they came back and almost tied it at the end last week. And we'll get another shot at them next week and at Chicago. So I'm really hoping. So, all right. Y'all have a great day. Remember to be kind to everybody. Give people smiles, strangers smiles. Just make their day, make them a little happier. So, all right. Love you all, folks. Have a good one. Bye-bye.